Good morning. My name is Vejish and I'm in a group presentation for final integrated projects with Chun and Vejish. Our topic is called Toward an Enterprise Architecture for Healthcare Systems, State-of-the-Art and Future Trends. My part is to talk on the introduction and the context of the study. Our research question is, what are the problems or challenges that application of enterprise architecture in healthcare system face? In the era we live today, the healthcare industry is undergoing multiple transformation, and the transformation is mainly in the field of information management and the implementation of digital health frameworks. Organizations that are based in the healthcare industry have shown an increased willingness to adopt information technology in their healthcare processes. So this increased level of technology adoption has led to the adoption of enterprise architecture in the healthcare system. Now I'm going to look at the benefit and potential risk of enterprise architecture. The root reason behind the increased adoption of technology and enterprise architecture is the benefit they bring to the organization once implemented. I'm going to look at the table 1, which talks about the organizational benefit from enterprise architecture implementation as reported in the literature by looking at the academic studies as well as professional studies. We're going to start with the academic studies by looking at the systematic literature review, which included 50 studies and came up with the following benefits. Number 1 is increased responsiveness and guidance to change. Number 2, improved decision making. Number 3, reduced IT cost. Number 4, reduced IT alignment, just to mention a few. Another academic study was done by SIM Enterprise Architecture of 2007, who also came up with the following benefits of enterprise architecture implementation. Number 1, improve interoperability between information systems, improve utilization of IT, aligns business objectives with IT investment, and improve return on investment from IT spendings. Now we're moving to professional studies. We're looking at the Infosys Enterprise Architecture Survey of 2009, which explained the benefits to be improved customer satisfaction, reduced IT cost, business process improve and standardization, better business IT alignment. And TOGAF 9 explained the benefit to be more efficient IT operation, lower IT cost, maximum return on investment from existing IT, and reduce risk for future IT investment. Zachman International explained the benefit to be alignment enabler, integration enabler, change enabler, and reduce time to market. Now we can see that the overall benefit of enterprise architecture is the better alignment of IT with business strategies. And in practice, if the enterprise architecture implementation is not done as per the business requirement, then it can just increase complexity at a later stages. The digitization of healthcare services as well as the implementation of enterprise architecture has led to improved services and flexibility to care seekers, the patients. For example, today a patient can book an appointment with a medical practitioner from his mobile phone and at his preferred slot, even without going to the hospital. So this saves time for both caregivers and care seekers, and at the same time adds more convenience and flexibility. The aim of this paper is to explore the challenges that the organization face, particular organization in healthcare system. And the most important contribution of this paper is to focus on possible setbacks and obstacles the healthcare system organization will face before, during, and after enterprise architecture implementation. So the paper provided direction for future enterprise architecture implementation for such organization in order to aid the process to be easier, smoother, and more seamless. So we have used systematic literature review as well as defined methodology to achieve this goal. We present the context and the literature review in the second section, followed by the research methodology. In the fifth section, we present this discussion and findings of the research. And in the last section, we discuss the contribution, limitation, and future works. Now I'm going to talk on the context of this study. In spite of the increasing level of adoption of enterprise architecture in different organizations, many have struggled in the implementation of enterprise architecture due to its complexity and level of customization it requires. The development of ICT adoption has always been challenging, and at the same time, most organizations face similar challenges in the implementation of enterprise architecture. In this study, we have pointed out that it is important to differentiate between technological implementation and enterprise architecture implementation, and thus the focus is on the challenge that healthcare system organization faces in relation to enterprise architecture implementation that refer to framework including Zachman architecture, federal enterprise architecture, and open group architecture. The scope of healthcare system organization in this study refer to hospital, NGO organization, nursing home, rehab clinics, pharmacies, and any organization that have relationship to maintenance or improvement of health through prevention, diagnosis, treatment to physical and mental impaired people. Even though the most common use of enterprise architecture framework for healthcare system organization is not the prime focus of this paper, we explore the most commonly used framework for healthcare systems organization and discuss if the inherent disadvantage of such framework will have an impact on the challenges that healthcare system organization will face. Thank you.
Thanks, Faith. Next, I'm going to discuss the research methodology that we used. We used secondary study, and we set some criteria to keep our study manageable. The first criteria that we set is to search only articles, conference proceedings, journals, and books. Also, we limited our research database to Google Scholar, Scopus, Science Direct, and also ResearchGate. On the right-hand side, you can see there's a reverse pyramid. That's the step we've took to our research, and we've gone from 81 down to 23 articles. Next, I'm going to hand it to Vejish to talk about the EA framework introduction.
Hello everyone. Introduction to Enterprise Architecture. A simple introduction to enterprise architecture is a strategic planning initiative that aligns businesses and IT. It helps to connect applications, technology, and data to the business functions visually and conceptually. There are multiple architecture frameworks available to develop enterprise architecture in an organization, and in this study, we have reviewed most commonly used enterprise architecture frameworks. They are Zachman framework, Treasury Enterprise Architecture Framework, and the Open Group Architecture Framework, also known as TOGAF. Zachman framework. It is known as fundamental framework for developing enterprise architecture. This is made up of two-dimensional schema. Many organizations used Zachman framework as the base framework for developing logical structure that will categorize the business activities, arrange them, finally reflect complete organization. It will help organization to develop, design, integrate, manage, and access the information system. Second one is Treasury Enterprise Architecture Framework, also known as TEAF. This is a framework based on Zachman framework, and it is developed for organizations that are engaged with the Treasury Department. Purpose of developing this enterprise architecture framework is to standardize the ever-changing IT implementation and IT practices in Treasury Department. Key features of TEAF are guide different Treasury bureaus and its information system, provide unification and standardization, provide ready-made template for information technology implementation for various business functions. The third one is the Open Group Architecture Framework, also known as TOGAF. It is the most popular architecture framework among the framework that we have discussed in this study, and it is one of the most adopted framework across the world. It is a generic framework and it can be applied to any industry or any segment. Some of the key features are its modular structure, content framework, enhanced guidance, and flexibility to implement. Another key concept of TOGAF is ADM, Advanced Development Method, which is a systematic cyclic method that is used for developing enterprise architecture. It is a part of the Open Group and based on United States Defense Department Technical Architecture Framework developed in 1995. Next, I would like to discuss about the role of enterprise architecture in healthcare. As we know, healthcare organizations are facing multiple issues and main concerns are variations in medical records that is generated by different organizations, medical errors, and incapability to provide medical services when medical professionals are not available or not present. Another challenge that exists in the industry is interoperability among systems, and it is required integration to function effectively and efficiently. Lack of consistency in electronic medical record is also a challenge in modern medical world, as this happens when there is a lack of well-defined standardization. Enterprise architecture or EA address this challenge, and it's already proven its benefits in different industries. In healthcare service, medical professionals need right information on right time, and this can improve medical services and save many lives. Developing interoperable capability in various medical information systems will help to integrate, and enterprise architecture is a solution to achieve this goal. For instance, there are multiple IoT devices which can monitor body metrics such as pulse rate, oxygen level, and blood pressure, and if any of the reading shows abnormal, it should send an alert to monitoring system, which will forward this alert to right healthcare professional through different messaging system, which is already integrated with the monitoring system. And we have a proposed model for hospital information system, which is mentioned here, and in a correct order, which is re-engineer business process, then initialize architecture, business develop business architecture, develop information system architecture, develop technology architecture, and assess readiness.
Thank you, Vejish. Next, I'm going to discuss our findings. So to start with, we have used Banajoromi and Smokelander's study called Understanding Obstacles in Enterprise Architecture Development to differentiate different types of challenges that the healthcare organization faced in regards to EA implementation. Basically, we as the reviewer asked ourselves 4 different questions to categorize the challenges, such as is it related to business nature, or is it related to EA tools infrastructure and configuration, or is it related to staff resistance, communication and training, or is it related to management and leadership? So inside these 4 different categories, we have created subcategories to further dissect the challenges. Now I will provide an example for each challenges to further explain what we meant by that challenge. So the first one is industry specific, which is categorized as a environmental challenge. Healthcare is, as we all know, is a very complicated and specialized industry. Hence, it requires knowledge to stand up an EA in such organizations. Second is interoperability, which is also arisen from the complexity of healthcare organizations. Gaps sometimes are invaluable. Third one is the data collection. Again, data is always a hot topic in healthcare organizations because of its nature and of sensitivity and importance in patients' recovery process. This challenge was mentioned multiple times in different studies. Next is the technical challenge. The first one that we saw is the security issue. So healthcare industry, it's not a new industry, and there are a lot of legacy systems that they used running at the same time, which has little or no security controls at all. Second is the integration challenge. Well, you cannot just shut down for weeks or months to implement a perfect EA. The systems that they've used and process that they are implementing has to be running at the same time in parallel. So they will want integration to happen at the same time. The old processes and the old system that they are using has to be merging into the new processes and new systems. So integration is always complicated because of different kind of issues such as infrastructure or data related issues. Next, we have organizational challenges. So first, we have awareness and training challenge. We have found that organizations are struggling to provide adequate training to end users. And the reason is, first of all, knowledge. There's a knowledge barrier because you would need someone who can speak IT language, business language, and healthcare language at the same time. Second of all, the time in healthcare organization is very, very valuable and precious, and the people working in the organization are usually with higher hourly rates, and it will be very, very costly for them to split a day or two, or even few hours to attend the training on how to operate with the new processes. In addition, another hot topic is the awareness. When we talk about EA, it is always related to change and related to awareness. And healthcare workers usually are fully concentrated on saving people's lives or helping people with their health. And they do not pay enough attention to EA, and hence there's a challenge. Other than that, we also found that there are conflict of interest. For example, what the project manager wants is not always what the engineers of EA want. Project manager wants to finish everything before the due date, but the engineer might need some more time to build up the development, and therefore to manage that properly is a challenge. Lastly, we found some managerial challenge, which we found commitment challenge and the challenge of vision and strategy definition. So commitment challenge refers to the management commitment on EA. It transforms as the action and support that the management has given to EA in terms of fundings, capital, human resources, and technical resources support. So it has been shown that sometimes management of healthcare organizations did not give enough commitment towards EA. And the last challenge we found is the definition of vision and strategy. Management said that they have found it difficult to describe the value of EA, and as a result, they cannot create a well-defined vision and strategy for EA, and things can easily go downhill if it's not well defined in the first place. So in our conclusion, we do want to reiterate that we do have limitations in our study. We selected only a number of references based on their title, and certainly there are articles that are relevant, but we have missed if they did not fit into our criteria. Also, even though we asked the 4 questions to categorize the challenges, there are some human judgment involved, and that might impact the classification of challenges. On a final note, what we have learned is that the real challenges are not those you get prepared, but those you encounter surprisingly and those that caught you off guard. That's the end of our presentation. Thank you.